dissolved in the blood, and 100% of hemoglobin is saturated with oxygen. It has about 40% of that left when it gets back to the lungs. So it's deoxygenated. When the left atrium is receiving oxygenated blood from the lungs. So there are three major vessels that empty deoxygenated blood into the right atrium. From the head, the neck, chest, and upper extremities, we have the superior vena cava. The superior vena cava is carrying blood from the head, neck, upper extremities, and chest. And again, when we do blood vessels in a week or so, we'll be going over these. That would be this vessel right here. Inferior vena cava. There's only, again, about an inch of it or so in the thoracic cavity. The rest is from the abdomen. So the inferior vena cava is bringing blood from the lower extremities. Abdomen and pelvis. And then this little opening right here, it's not on your diagram, but it's a small opening about the size of a pencil, just to the right of the inferior vena cava. And it's for a large, all the veins come together to form a large dilated vessel known as the coronary sinus. So if you have the heart models at your tables, if not, again, feel free to go get one. So on the model, here's the superior vena cava. Here's a little section of the inferior vena cava. And in the back of the heart, this is the coronary sinus. This large dilated vessel right here is the coronary sinus. And if you look inside the right atrium, you can see the opening for the inferior vena cava, and just to the left of that is the opening for the coronary sinus. Okay, so those are the three vessels, major vessels that empty into the right atrium. And coronary sinus is bringing deoxygenated blood from the heart itself that it's used for its contractions.
It looks like a blood vessel, right?
Yeah. It's a thin-walled vein. So if we look at this diagram of a heart, here's the superior vena cava, inferior vena cava, and it's not showing the coronary sinus, but it would be right here. Okay. When we look at just the right atria, this is from Netter's. So here's superior vena cava, here's inferior vena cava, and here's the coronary sinus opening. When we look at, in the lecture today, we'll be looking at the veins. Yeah, it would be medial. Or actually, the heart is in the midline, so it's actually going more lateral. This would be the midline of the body right here. So it's to the left of that. So this is a posterior view of the heart. So this vein dilates to form the coronary sinus, and the other veins drain into it. And then right here, just here's the inferior vena cava opening. So right beside it, when you look at your sheep hearts, you'll see an opening that you can put the metal probe into, which is for the coronary sinus. So those three structures are how blood gets into the right atrium. In addition, as we'll see when we talk about coronary circulation, there are 2 or 3 individual veins that drain directly into the right atrium, but they're so small we don't see openings inside the heart wall for them. Okay. All right, so going back to the atria, left side. Okay? And you'll notice that the left side, again, is receiving oxygenated blood. And so from most of the left atrium, all of the left atrium, is seen posteriorly. So from the front, we're seeing just a little bit of this auricle, but the posterior surface is the left atrium. And you'll notice there are 2 vessels from the left lung, 2 vessels from the right lung. They're carrying blood to the heart, so they are veins. They're carrying oxygenated blood. So these are pulmonary veins. All right, so in the adult, these are the only veins that have oxygenated blood in them. We talked about the umbilical veins in the fetus. So from the right and the left lungs, we have the pulmonary veins. So these would be right set of pulmonary veins here, and left set of pulmonary veins here. So again, blood flow is in this direction. And this little circle here is just this vein emptying into that. Now the sheep hearts, unfortunately, they started lopping off most of the great vessels. So you probably won't see it, except I think I found one superior vena cava in this morning. So they're cut basically like this. So you'll see the pulmonary trunk in the aorta, but you'll just see big gaping holes in the right atrium and the left atrium. So you probably won't see those specific components. Now, structural characteristics that we find in both atria. If you look on page 18, I have these vessels listed. And in the auricles, those little clusters that you see, we have ridges of cardiac muscle known as pectinate muscle. So again, on the model, you look in the auricle, the rest of the atrium is smooth, but here would be the pectinate muscle. All right, on the right side, here's the pectinate muscle. Not as much as on the left side. The auricles really don't have much function. Yes, they will contract and along with the whole atria put a little bit more blood into the ventricles, but you could get rid of that entirely and suture the atrium closed and you wouldn't really notice much difference in function. So both atria are going to demonstrate pectinate muscles. Again, by definition, ridges of cardiac muscle in the auricles. And in the interatrial septum, people ask on the list and the lab list, interatrial septum, where's that? Well, if you put your thumb and forefinger in the right atrium and the left atrium and try to pinch them together, that's the wall between the two atria. That's the interatrial septum. I never asked for identification in lab, it's just too difficult to get across. Basically name the wall between the two atria and you're kind of defining it there. But you can see it here. All right, so superior vena cava, inferior vena cava, right set of pulmonary veins. And right here is the fossa ovalis. It's a thin area that was an opening in the fetal heart. So under some of the, around on the tables are some of the sheep heart, not sheep heart, but they're probably cow, the plasticized hearts. And if you hold them up to the light, you can see a thin area within the wall that was, I'm not sure you can see it in that one, it's the bigger calves that are around somewhere. Oh, there's one on my desk. I'll pass it around. So, you look, and this would be the interatrial septum here. Hold it up to the light, and you'll see a thin area. And that is the fossa ovalis. So, yeah, So in the fetal development, remember it talked about the wedge of tissue growing and closing the atria from each other, and it left a gaping, a hole, and like here was the atrial septa, and it grew until there was a hole there this way, and then the wall grew back and grew until there was a hole that way. So it's like two sliding pocket doors that do this. All right, and then as blood flows from the fetal liver to the heart, it's mostly oxygenated because it's come from the placenta, and it comes in the inferior vena cava at an angle that most of it hits that and opens this inner flap and allows blood to go into the left atrium. We'll talk about cardiovascular circulation, but the reason is that blood is already oxygenated. It's come from the placenta. All of it doesn't need to go to the lung. It needs to go to the body. And so this allows it to bypass the right ventricle, bypass the pulmonary trunk, bypass the lungs, and go directly into the left atrium, the left ventricle, and get pumped to the body. Question? Once the baby is born and takes a breath and the pressure drops, then it's easier to go to the lungs. And so over a 1 to 3 day period, those two layers fuse together. So often babies will have a little bit of a heart murmur. If that hasn't completely fused in the first couple of days, there'll be a gurgling or an irregularity in the sound, but then they grow together, and the fossa ovalis is what is left. So it's the closed foramen ovale of the fetus. And again, we'll have a whole lecture portion on just fetal circulation. It's also seen in the right side, but not as prominent. So this is looking at the right atrium. So fossa ovalis is the name of the fused foramen ovale, and it's shared by both left and right. So again, foramen ovale is a fetal structure. The adult or after birth is postnatal is called fossa ovalis. If you call it foramen ovale or vice versa, half credit. Okay, so closed is fossa ovalis, fetal, foramen ovalis.
One's an indentation and one's a hole. Right?
Forward, pardon?
One's an indentation, one's a hole.
Well, one's this, and then there's this. Yes.
That's right, right.
Yeah.
Oh, so it's not a direct hole.
It's not an open hole. It's a channel. It's kind of like a flap, a one-way valve. We call it a
Check
flutter
valve.
valve. So blood will flow this way, but when it's coming from this side, it pushes that closed. So that's why after the baby is born, when pressure is greater on the left side, then it doesn't go through.
So that's going to go on both sides of the atrium, right and left?
You would see it on both sides. It's just easier to see it. So here it is on the right, on the left side. It's just easier to see on the right side. On the sheep brain, on the sheep hearts, because of the way we cut it, you probably won't see it. We kind of cut right through it. So it just depends on the cut, whether you'll see it in the sheep heart or not. All right, so here is the sheep heart with the left atrium cut open. Here's the fossa ovalis. It's actually easier to feel than to actually see. They have a light shining behind it. Here's the pectinate muscle. You don't have to worry about the crista terminalis. Here's the pectinate muscle. So when blood flows into the atrium, it's going to flow directly from the atria into the ventricle. So the heart is at rest most of the time. And the pressure pushes the blood flow through the right atria into the right ventricle, or through the left atrium into the left ventricle. It goes through an opening surrounded by valve leaflets known as the atrioventricular valve. And you can see those right here. The right side has 3 leaflets called tricuspid, and the left side has 2 leaflets, or bicuspid. If you prefer not to remember whether, well, you kind of need to know, but if you can't remember whether it's the right side that has 3 or 2, just call it the right atrioventricular valve. Atrioventricular valve means it's between the atrium and the ventricle. We have a right atrioventricular and a left. Often that's abbreviated to AV valve, but as you've learned, you need to write the whole thing out for a lab quiz or a lab exam. So you might find bicuspid and tricuspid a bit shorter. So either one is fine for identification.
Which one is 3?
Tri is the right side,
Right.
and bi is left. So here's the right atrioventricular valve on an opened up chamber. Up here would be the coronary sinus. Here are the 3 leaflets. On my diagram, I just have 2. The third was in the half that I didn't draw. That's kind of what I cut away. And attached to each of the leaflets are strands of collagen fibers so that the leaflets hang down into the ventricle. And these, so we're switching now that we've gone through the atrioventricular valve. So let me identify. I'll just write tricuspid, it's shorter. So tricuspid valve. And it's thought because the heart is more on the left side that we only have 2 leaflets because of the lungs not being able to allow the heart to develop as much. The lung only has 2 lobes on the left side versus 3 on the right. So these would be bicuspid valves. And then from each valve leaflet are these strands of fibers that are connected to a mound of muscle that you see here. So may I erase this list here? And I'm going to put the pumping chambers down. Okay? We're going to have the right AV valve and the left AV valve, and then the blood will enter the right ventricle.
Professor, did you give a name? 40 TV, is that what they're called?
I'm going to put them up in the board in just a moment. So the right ventricle is pumping blood to the lungs. Pumping deoxygenated blood to the lungs. That blood returns to the heart via the pulmonary veins to the left atrium, goes into the left ventricle, and now the left ventricle is pumping oxygenated blood to the body. So both of them have the AV valves. These strands are identified, so both of them now are going to have these structures. So they're going to have the AV valve leaflets. Those are attached via the chordae tendineae, or the tendinous cords. Chordae tendineae. That's these. And the chordae tendineae attached to papillary muscle. Somebody thought it looked like small breasts or pap for teeth. So we have a papillary muscle. So right atrioventricular valve has 3 leaflets. And here's the right ventricle opened up. And you can see how when these are open, it kind of looks a bit like a tent. And here are the chordae tendineae. On the right side, there is part of the conduction system. We'll talk about this tomorrow, which is called the moderator band. You will see this in your sheep hearts as well. It can be as thick as this, or I saw one today that was even thinner in comparison to one of these chordae tendineae. So they'll vary in size. It's nerves. It contains nerves. It's not part of the papillary structure, but it goes from the septum to one of the papillary muscles. All right, then the left, or bicuspid, has 2 sets of leaflets attached to the papillary muscle. Now, how does this work? We'll look at cardiac cycle tomorrow and on Tuesday. When the heart is at rest, again, blood is flowing into right atrium and left atrium, directly passes through the open valves into the right and left ventricle, both at the same time. The right and left atria contract briefly to squeeze a small amount of blood, additional blood into the ventricles, and then the ventricles start to contract from the bottom. And the right ventricle contracts and the left ventricle contracts, and note the valves are hanging down like this. Pressure closes the valve, not muscle. So when we have a closed chamber and we make it smaller by contracting that, what's going to happen to pressure? It's going to go up. So blood pushing up on either side of the valves pushes them together. If you listen to a heartbeat with a stethoscope, that first sound that you hear is the lub. The lub, lub, is the lub is the slamming together, if you will, of the atrioventricular valve leaflets. So it's a blood pressure force pushing them together. Now the other valves leaving the chambers have not yet opened, and so pressure rapidly goes up. So much so that those valve leaflets are in danger of inverting and letting the blood flow back up into the atria. So the purpose of the chordae tendineae and the papillary muscles is to keep the valves directed downward. The papillary muscles don't close the valve leaflets, they adjust the tension with the force of the muscle contraction. So these will pull on that as the pressure is increasing to keep the pressure from pushing the valves back up into the atria. But it's the rising blood pressure as the ventricles are contracting that actually closes the leaflets.
So that was
Closes
the
valve.
chordae tendineae, and what was the other one? The
The
papillary
papillary
muscle
muscles
to keep the
adjust
valve
the
down.
tension
Okay. Okay.
when the valves are closed. Yes. Like an umbrella turning inside out in a windstorm.